It is service learning and how it links to the small group community resource project in this course. Service learning provides the structure by which you'll approach this project. So I'm sure you've been asked over the course of your current education and even prior to entering the PT program, why did you decide to become a PT? And the common link that to the answers that most students provide is that they want to help people. They want to provide service. And service is defined as the contribution to the welfare of others, a helpful act. How many of you know what Concordia's mission statement is? Concordia's mission statement, as you'll see on the screen, is that Concordia University, Wisconsin is a Lutheran higher education community committed to helping students develop in mind, body, and spirit for service to Christ in the church and in the world. So service is an important part of being a student at Concordia. The Concordia Physical Therapy Program's mission statement reflects that same mission of service. The Concordia University, Wisconsin program in physical therapy is committed to developing healthcare professionals who have a sound foundation in movement science and are prepared for safe, autonomous, and ethical practice as physical therapists within a changing healthcare environment. The program seeks to foster personal growth in mind, body, and spirit for Christian service to the community. So this concept of service is very consistent with the mission of our program and of the university. And then we look at this concept of learning. Learning is defined as gaining knowledge or understanding of or skill in by study, instruction, or experience. Obviously, you're here in the physical therapy program to learn how to become a physical therapist. So there's a number of teaching methods that we can use to help you to learn. So some examples of these are listed on the slide. We can do lecture, we can do lab so that you can apply what you learned in lecture or prior to class. We have clinical education where you go on clinicals and internships and you apply the knowledge that you've learned in the classroom. We have you do assignments, again, so you can apply knowledge. We do discussion so that you can begin to gain other people's viewpoints and which might help you to think of things in a different way. We do team-based learning where you work within a team format. So again, you obtain viewpoints and allow others to add to the knowledge that will help you to learn. We have problem-based learning where students identify for themselves what they know, what they don't know, and what they need to seek out in order to make decisions, in our case, regarding patient care. And then we have examples of where we may ask you to teach something because that is one of the best ways to actually learn information. And then we have this concept of service learning. Service learning is just another one of the teaching methods that we can use here in the physical therapy program. So what is service learning? You've already read the article by Serena Safer, and Serena is one of the individuals whose name is synonymous with. So in the article that you read, Safer defines service learning as a structured learning experience that combines community service with explicit learning objectives, preparation, and reflection. So when students participate in service learning, they not only provide community service, but they also learn about the context in which the service is provided. In our case, with the Community Resource Project linked to this course, you actually learn about the community agency who serves the needs of a specific population. And in that way, you see a connection between the service that you're providing your academic coursework, and in your bigger role as citizens. So the article that you read did talk a little bit about how service learning differs from other service programs, but I want to go into a little bit more detail of this so you can really see the difference. So this diagram is from an article from FERCO. And FERCO does a nice job of diagramming these 5 different service programs and how they're similar to each other and how they're different. So all service programs have two common factors. They each have an intended beneficiary of the service, and they each focus on service and or learning. And that's what's indicated on the top of this diagram. But how they differ is the balance that there is between these 2 factors. So this model really depicts this difference well among these 5 different service programs. So we're going to go over them one at a time. So if we start with community service over on that left side, if you look up at the top, who is the beneficiary and who is the focus? The beneficiary of community service is the recipient of the service. It's usually a community and or its members. What's the primary focus? The primary focus is on that service provided. It doesn't mean that those who provide the service don't learn. It's just that learning is not the main focus of that activity. So some examples of this would be maybe working in a food pantry, putting together food baskets for the homeless, building homes for an organization like Habitat for Humanity. In providing community service, you're helping a larger group within a community. Volunteerism is the other service program that's listed over on this left side. So volunteerism is even more designed to help the beneficiary of the service, and it's even more focused on providing the service. The benefits are for a more specific group of people within a community or an individual. So again, some examples might be collecting food for a food drive, and that food goes to a particular group or population. Working at a community screening event would be an example of volunteerism. In my case, I coordinate the Special Olympics Fun Fitness screening. That would be an example of volunteerism if you participated in that Fun Fitness event. And then if we look over on the right side of the model, we see field education or field work. So on this side of the model, you can see that the beneficiary is more on the provider of the service, and the learning focus is on the provider as well. So field work, field education, who's the beneficiary? It's usually the student. The primary focus is the learning that the student can acquire from the experience. Again, it doesn't mean that the recipients of the service, in our case in physical therapy, it would be the patients or clients. It doesn't mean that the recipients don't benefit, because obviously they do. It's just that that's not the major purpose of field education. The major purpose is for the beneficiary to be the student so they can learn applied knowledge. So some examples in our physical therapy program would be going off-site, for example, to the VA, linked to a class to observe or work with a certain client population, patients with amputation, patients with spinal cord injury, maybe observing a surgery, which many of you are able to do on your clinicals. And then the other service program that's in this model is internship. So the internship is more similar to our clinical education. Our clinicals are internships. So the primary beneficiary, again, is you as the student. The primary focus is on the learning rather than the service provided. So the internship is just more specific than the field education. So among all these service programs that are depicted in this model, only service learning has an equal focus on the benefits. So for both the provider and the recipient of the service, and an equally weighted focus on providing meaningful service while significant learning occurs. In fact, that concept of reciprocal learning between the recipient of the service and the provider of the service is one of the hallmarks of service learning. So again, the definition of service learning is a structured learning experience that provides community service with explicit learning objectives, preparation, and reflection. So students not only provide community service, but they also learn about the context in which the service is provided, and there's a connection between the service, the student's academic coursework, and in the student's role as citizens. So here's how service learning differs from those other service programs. Again, there's the balance between the service and the learning objectives. So the community resource project, the service learning project that we do in this course, health promotion, there are learning objectives that reside within the course, and your completion of the community resource project is the way in which you meet those learning objectives. And yet your collaboration with the community partner, the agency within the realm of this project, you are also providing service. There's an equal focus, though, on the benefits for you as the provider and the recipient, which is the community agency, the population that they serve. And the emphasis is on reciprocal learning. So more traditional definitions or roles of faculty, teacher, and learner are intentionally blurred with service learning. And this reciprocity of reciprocal learning is the cornerstone, one of the cornerstones of service learning. So you as the student are providing the service, and so the community agency members are learning something from you, but you are also learning from them because you're providing the service within the context of their environment. So you're learning a lot about them and from them. That's the concept of the reciprocal learning. And then this emphasis on developing citizenship skills and achieving social change. Service learning emphasizes the importance of understanding and addressing the many factors influencing health and quality of life. We've already talked about that in this course when we think about the ecological model of behavior change, where you need to consider the social and the physical environment in which behavior change needs to occur. By looking at these different factors that could influence health and quality of life, for example, for the population served by the community agency that you'll be collaborating with this project, it enables you to really place your role as a health professional and a citizen within the larger societal complex. And then this emphasis on reflective practice. So you have had opportunities to participate in reflective practice since you first entered our program. When we have you do formal reflective journaling, when we have you do reflection papers after clinicals, when we have you reflect on some guided questions after a learning activity, all of which help you to gain a deeper understanding of the content that is linked to that activity, and also helps you to understand more about yourself. In general, reflective practice is very important for any healthcare provider because it helps you to make sense of your observations and your experiences. And in the case of this community resource project, it helps make sense of those things within the community. It really helps connect your service to your learning. Reflective practice also encourages you, again, to consider the larger social, political, economic, and cultural context of the community concerns being addressed because you're actually providing the service within that community. And then finally, there's an emphasis on addressing community identified needs and how important it is to have the active involvement of the community partners. So what service learning is not, it is not a university, a program within a university going to a community partner and saying, we have this service to offer, we're going to offer it. It's collaborating with that community partner for them to share with you what are the needs of the population that they serve, and how can you, with the background that you might bring, the experience that you bring, be able to provide that service to them to best meet their needs. So when designing, implementing, and evaluating the community resource project that you'll do over the course of health promotion, it's important that you maintain that active involvement of the community partner to be sure that what you are creating for them is a sustainable resource that's going to continue to meet their needs. In this way, it helps you to continue to focus on the strengths and assets that you might bring to the project, but also the strengths and assets of the community, and how you can work together to create the product that they're asking you to for the community's benefit. Sustainability is the huge piece of service learning. It's important that when we provide the service component within service learning, that it is a service that is somehow sustainable by the organization. So it is not always helpful for us to go in and provide a service to an organization which very well might meet the needs of the population they serve, if that product cannot be sustained. If it always relies on you to provide it, that's not sustainable, and you are not meeting that organization's needs to the best of your ability. So this Chinese proverb, if you give a man a fish, you feed him for a day. If you teach a man to fish, you feed him for a lifetime, is a nice cornerstone statement of service learning. So I think it's important that you have an understanding of the origin and evolution of service learning, because it really helps you to better understand not only the key concepts involved, but really to better understand maybe your role as a student within a program within the university. So in a way, we've kind of come full circle with service learning. In the late 1800s, the main roles of colleges was to prepare civic and religious leaders. They were designed to help find answers to the country's most pressing social, civic, economic, and moral programs. And this was done through collaboration between the community and the academic institutions. In the past 100 years and more, institutions of higher education, colleges, universities, have actually moved away from this purpose and have really more come to be viewed by the community as a place where students go to get credentialed, they go to earn degrees, and faculty get tenured. John Dewey in the 1930s, John Dewey was a philosopher. He was one of America's foremost philosophers. He actually developed the Dewey Decimal System. He was very progressive regarding his views of education. In the 1930s, his proposal for educational and social reform included the placement of emphasis on the development of problem solving and critical thinking skills versus just rote memorization of facts. And he thought that this could best be achieved through experimentation and practice, through active learning. So in order for a student to grow and learn from these experiences, they must be able to meaningfully reflect upon them. So that concept of reflection, active learning, experiential learning has been around since the 1930s. Paulo Freire Freire was a Brazilian educator. He grew up in poverty in Brazil, and he vowed that no other child would go through the same thing that he did. And so, in so doing, when he became an adult, he developed a method of teaching the illiterate and the poor of his country that encouraged them to critically look at their situation and take initiative to change it by transforming society versus waiting for others to do it for them or to them. Robert Sigmund in the 1970s emphasized the empowered role of those being served. He actually defined the term service learning and summarized it with 3 principles. He called on community members to control the services provided. So the members who were receiving the service should have control over that service. And those in the community being served would become better able to take care of themselves and the issues that plague them, again, versus somebody coming in, providing the service, and then leaving. And that those who provide the service are labeled learners as well, who will have significant control over what is learned through the experience. So the recipients of the service are learners, learning from those who are providing the service. David Kolb in the 1980s, you know a little bit about already because you have completed the Kolb learning style inventory. David Kolb in the 80s proposed his experiential learning theory, which you've been exposed to in the first year of our program. David Kolb described that there are 4 different aspects of learning, and those are part of the learning cycle. And although an individual would have a preferred style of learning, and that's what was identified in your completion of the learning style inventory, as a learner, you move through all 4 parts of the learning cycle. And David Kolb also felt that reflection was important because it creates that necessary link between the concrete and abstract concepts. And then in 1985 is around the time that service learning within education was really gaining a foothold. The Campus Compact, which was developed in 1985, is a coalition of over 1,000 college and university presidents who band together to show their dedication to promoting community service, civic engagement, and service learning in higher education. So universities and colleges now can choose to belong to the Compact and pay an annual fee to be able to do so. The development of Pew Health Professions Commission in 1989 was key in really moving service learning forward within education. The Pew Health Professions Commission had a mission to assist policymakers and educators in producing healthcare professionals who could meet the changing needs of Americans. And we'll talk in a moment about how those needs are changing. You'll become more familiar with Healthy People 2020 in this course, but Healthy People 2020 has been around since 1990. It's a national initiative that was launched by the Department of Health and Human Services with a goal to ensure a competent allied health workforce to address the changing health needs of Americans. And then finally, development of health professions, schools in service to the nation, HPSISN. This occurred in the mid-90s, and it was created by a grant that came from the Pew Health Professions Commission. And it essentially funded 20 universities across the country to integrate service learning into the curriculum and professional programs and to study them so that they could study the positive outcomes that came from them, both on students and the members of the community that were served by service learning projects. And then we need to think about changing U.S. demographics. The changing demographics in the U.S. has made service learning even more important because it is a way that we can better prepare a workforce to meet the needs of a very culturally diverse demographic group. So by 2020, there will be 50 million older Americans, 70 million by 2030. This is going to require that healthcare be provided by healthcare professionals who are trained to treat the older patient. By 2050, 50% of the U.S. population will be non-white ethnic minorities. This will require a very culturally competent medical healthcare providers. And then we have the changes in healthcare delivery that have been occurring over the years. We have had a growing number of individuals who are uninsured or underinsured. Now, there's been a positive impact of federal legislation such as the Affordable Care Act, Obamacare, which really worked to help to decrease the number of uninsured and was successful in that. However, there are still a number of uninsured and underinsured individuals in our country. There's been a trend for the past several decades toward employer-based models of coverage. So this tends to shift more and more of the costs of insurance to the insured, to the person that is insured. So it costs more for individuals to obtain the health care that they need. And so this has required and led to a need for more free or lower cost options for healthcare to avoid losing assets due to health-related expenses. So we need some other options for providing care, and that care needs to be provided by a workforce that is well prepared to meet not just the cultural diverse needs of the population, but do it in a cost-effective manner. There's also been many professional initiatives within our own profession that links very well with service learning, the utilization of service learning in an educational setting. So again, here's the APTA vision statement: transforming society by optimizing movement to improve the human experience. That human experience occurs within the social and physical environments in which people live. One of the guiding principles to achieve the vision we've talked about already in class: access and equity. The physical therapy profession will recognize health inequities and disparities and work to ameliorate them through innovative models of service delivery, advocacy, attention to the influence of social determinants of health on the consumer, collaboration with community entities to expand the benefit provided by PT. And this will serve as a point of entry to the healthcare system and direct outreach to consumers to educate and increase awareness. How could we better prepare you to reach this aspect of the vision of our professional association than to help you begin to collaborate with those community members that you will be serving in your future profession? Several years ago, the ABTA came out with this plan for cultural competence. It was their way of demonstrating the importance that they place on cultural competence. Cultural competence refers to the set of skills necessary to understand and respond effectively to the cultural needs of each patient client. One of the goals related to this plan is to facilitate the development of culturally competent physical therapists and physical therapist assistants. One of the ways in which we can do this is using service learning as a format within our curriculum, which puts you into direct contact with a culturally diverse community as you collaborate with them with the community resource project that you'll do in this course. And then finally, the APTA Code of Ethics. Again, we've mentioned this already. Principle 8 is physical therapists shall participate in efforts to meet the health needs of people locally, nationally, and globally. Participation in service learning activities will definitely help to meet this principle within our Code of Ethics and really allow you to practice at the highest level of your license with the highest quality care that you can. Okay, so let's talk about the community resource project within this course. There's a general description of the project in the syllabus, but you will be receiving more information on it as we talk in class. But essentially, this project provides small student groups. You'll be working in groups of 2, sometimes groups of 3. It allows you to collaborate with a community agency and partner to provide that partner with a sustainable resource that will positively impact the health and wellness of the population they serve. All of these agencies, partners, I've already been in initial contact with to get a sense of what their needs are, to get a sense of their idea for the project. So you'll be going into this with a general idea of what you'll be completing, but part of the process of the project is then just clearly defining that, negotiating that as you meet with that community agency. So in your pairs, you will be able to choose from a list of potential projects that I've identified already that have been proposed by these community partners. We'll do that in class. And upon receiving formal approval of your choice, then you will, within the next week or 2, go to that community site to meet with the agency, with the partner, to learn more about the population that they serve and to discuss details of the project. And it's during that time that you might negotiate some fine-tuning of the project based on your understanding of the project and what the partner, the agency, needs. I will then have guidelines that you'll follow to create that agreed upon resource for the partner. We'll link these projects to Healthy People 2020, which you will be oriented to as a part of this unit as well. Any subsequent meetings and communication then that you have with the community partner after that on-site meeting is at your discretion. So it's whatever you need to be able to complete that project. But I will tell you that using a guideline of meeting with them every 2 weeks or so to check in regarding the status of the project, share with them what you've done, make sure it's what they're expecting, I would highly recommend. And at the end of the semester, each student group will create a PowerPoint presentation which will have some guidelines, and that'll be your way of describing your project and sharing it with the class. And then following that, around that same time frame, you'll write a reflective thank you letter to the partner, which really allows you to think back on the experience, to describe what you've learned, as well as what you hope you were able to provide from a service perspective to the population served by that partner. So that's really the overall description of the service learning project. Of the definition of service learning, just to directly link this again to the project. So again, this is a project that's occurring within an academic course. You can tell that it's a very structured learning experience. It's got a format to it. It's got some structure, but it allows you to combine that provision of community service by creating whatever product your community agency partner is describing to you with learning objectives of this course. There's a lot of preparation in that I prepare you for the project, you meet with the community partner to prepare for the project, you clarify what the product is, and there is formal reflection at the end to help you to learn, to better determine what you learned as a part of participation in this project. How will this help you become a better healthcare provider? So again, within the service learning format, you'll not only provide community service by creating whatever product your community partner has identified, but you'll also learn about the context in which the service is provided, because you'll have an on-site meeting in most cases. You may even meet members of the population that are served by that community agency, and that'll help you better create these connections between the service, your coursework, and in your larger role as citizens. This sets the stage for the service learning project. We'll talk more about it in class, and I hope that you enjoy this different learning format that's going to be occurring in this course.